Hello everyone. My research is focused on development of Usp-4 dissolution method for Atovaquone nanosuspension, and I am Pratik Kakade presenting in front of you all. Objective of my research work is preparation of Atovaquone nanosuspension using QBD approach. Second, to adopt Usp-2 dissolution method. Third is to optimize Usp-2 dissolution parameters to Usp-4. This is main and core part of this research work. Then next is develop a USP4 dissolution method that can be used to predict oral absorption of atovaquone. Next is to study and establish an in vitro in vivo correlation. Next slide is global atovaquone market. If you see the graph of atovaquone market, you can find three different segments where atovaquone use majorly. First one is hospital, second is drugstore, and third one is other, that is for research purpose. Both these Atovaquone pure API and Atovaquone products graph or bar diagram you can see starting from 2019 or 2010 13 till 2026 or 2024. This market is growing upward. Then for next is why Atovaquone. This is drug of choice for the treatment of malaria, and second is for infection of pneumonia. 91 or more than 91 countries, they are using Atovaquone for the treatment of malaria and pneumonia. Nowadays scientists, they are developing Atovaquone formulation for the treatment of cancer. Then formulation choice, that is Mepron. This is a marketed formulation of Atovaquone suspension having dose around 750 mg per 5 ml. Then nanosuspension. If you see the tree diagram, drug having low aqueous solubility, higher log P and higher melting point can form inclusion complexes and nanosuspension. If you see the challenges of atovaquone, this is BCS class 2 drug having low aqueous solubility and high melting point with poor and unreliable absorption, and marketed formulation having higher dose with low bioavailability. All these factors or challenges which are responsible for low or poor dissolution rate. So our aim was to develop nano particles of atovaquone or nano formulation of atovaquone which can give us better dissolution and which can give us better bioavailability. So by using strategy, that is high pressure homogenizer methodology, we targeted to convert needle shape atovaquone pure API to nano size atovaquone. So this is a methodology. By using optimized parameter of QBD, we started with core or pure API of atovaquone, which was needle shape, and converted this to nano size atovaquone nano suspension or nanoparticle. Here you can see the cubic shaped nanoparticles of atovaquone having particle size around 810 nanometers with PDI of 0.2 and zeta potential minus 2.81. After this, we studied its in vitro drug release. For this in vitro drug release, we wanted to develop a suitable, robust, and highly sensitive method for the in vitro drug release. Then, on the basis of this USP4 characteristics or advantage, that is, this is the highly selective method for nano formulations or nano suspensions. Then again, it has very good accuracy, and this is robust method. Then with higher sensitivity, we can get the results with minimal manual errors, and because of automation it has very high demand, and again this is industrially feasible and scalable. You can clearly see the picture of USP4 dissolution apparatus of Sotex. These are the orange book parameters which we are adopting for development of USP4 method. Then we are optimizing these three parameters, that is flow, filters, and system, that is open and closed loop system, for the development of USP4 method. In this first parameter, that is flow rate, we started with 1 ml per minute till 3 ml per minute. With 1 ml per minute, we got more less than 10% drug release, and with 3 ml flow pattern we found clogging, so we stuck with 2 ml per minute flow pattern. Second is filter. We selected three different filter with where 0.1 micron membrane filter showing leakage or clogging problem, and 0.45 micron filter where we got diso in less than 30 minutes. That is very fast drug escapes. So we selected 0.22 micron filter, which is giving uniform and suitable results. And again, we wanted to develop industrially feasible economic method. So we had chosen closed loop system, which is uh, again uh, responsible to use low media volume. So these are the optimized parameter, that is media volume we are using 400 ml, pH is around 8, co-solvent we are using for 40% IPA. Then optimized parameter, that is flow 2 ml per minute, filters 0.22 micron cutoff membrane filters, or system is closed loop. After this, we studied in vitro drug release. Here you can clearly see Atovaquone pure APN marketed is giving 25% drug release at the end of 90 minutes, where developed nanosuspension is giving 100% drug release at the end of 90 minutes. So nanosuspension exhibited significant enhancement in dissolution parameters, which leads to its pharmacokinetic enhancement, that is in vitro pharmacokinetic studies, where you can see nanosuspension exhibited superior kinetic profile as compared to marketed formulation. As this method is more suitable, accurate, and sensitive, you can see the standard deviation error bar size, which is very less because of its method sensitivity. Again, we studied in vitro in vivo correlation of this developed nanosuspension. At this particular point, Tmax, Cmax, and its pharmacokinetic parameter explains level A correlation because with the unity line, because all the points which we had studied that are we observe around the or besides the unity line. Then next we studied in vivo regression, where in vivo regression performance of an nanosuspension predict its in vitro drug release profile and develop dissolution method and its dissolution limits. Then next point is compartment model. We studied this compartment model, and this compartment parameters confirm that the clinical correlation data can be used to study bioavailability in human in future. So on the basis of all these studies, we are concluding Atovaquone nanosuspension developed using QBD approach and nanosization of this Atovaquone, which is giving better bioavailability as compared to marketed formulation on the basis of in vivo release. Then developed USP4 method was found relevant for determination of in vitro release. And next point, that is most important, USP4 apparatus and method was found relevant to predict the bioavailability as well as PK, that is pharmacokinetic value of the drug with good accuracy. And last one, that is in vitro in vivo correlation, explains its R value, that is 0.95, which is confirmed with its correlation regression study. This is all about Atovaquone nanosuspension and USP4 method analysis and development. Thank you.